Now that we've sent a patient record, let's go back to the hub and send a referral. We can select the green circle into P, then select Send P2P Referral or Consult Note. Our outgoing referral screen will pop up, and we can fill out the fields as necessary. As we can see, our patient's name is already selected, but if it was blank, we can select the patient lookup icon to select our patient. We also have the provider that we're sending from populated, and this is because this is the provider we're logged in as. But to choose another provider, we can select the drop-down and choose the correct provider. Now we can select the provider we're sending to. I can click the ellipsis to the right and find a list of all of our referring physicians. To search for P2P providers only, I can use the filter at the top and change it from all providers to P2P providers. Once I find the provider I'm looking for, I will select the radio button to the left of their name, and their name should populate in the outgoing referral screen. To the right, we can fill out any field that's mandatory for our practice. We can also add a reason near the bottom by clicking Add and free typing a reason for our outgoing referral. You can add a diagnosis or a procedure code by clicking Add and searching for an ICD code or a CPT code. We can also click Attachment on the bottom left to add any attachments to our outgoing referral. We will get a pop-up that says we must save this referral before adding attachments, so I'll click Yes. And from here, we can add our attachments. For meaningful use, make sure to attach the medical summary, the CCR-CCD, which stands for Continuity of Care Record or Continuity of Care Document, and at least one progress note. To attach the progress note, select the plus sign and view a list of your patient's progress notes. You can select each progress note to the left-hand side and click OK. And the last thing for meaningful use is make sure that a medical staff member is verifying the patient allergies, current medications, and their problem list within each progress note. Once we click OK, we can see the progress note populate, and to attach any lab reports, x-rays, or patient documents, select the plus sign to the right. Once we click OK, we can see the number of attachments populate on the bottom left, and we can click Send Referral. Since we do have 2 P2P providers selected, it's telling us that this referral is ready to be sent electronically. I can send a reminder fax if I have their fax number. And now I just click Send. That concludes the video on sending P2P patient records and referrals. In the next video, we will see how to receive P2P patient records and patient referrals.